Hello and welcome to the Pleasure Academy, your trusted place for clear, respectful, and educational discussions about human health. Today we're exploring what it means when a woman's private area looks larger than usual, and why these natural variations are completely normal. 1. Natural diversity of the vulva. The first thing to understand is that the vulva comes in many shapes, sizes, and colors. No two women look exactly alike, and what one person sees as large may simply be a normal variation. Factors like genetics, hormones, puberty, and natural development heavily influence how the outer and inner structures form. Some women have smaller features, while others have more pronounced ones. This isn't an indicator of health problems or sexual behavior, just biology. Recognizing this wide range of normal appearance helps reduce stigma and allows women to appreciate their natural bodies without unnecessary worry or comparison. 2. Labia minora size differences. One of the most noticeable variations involves the labia minora, the inner lips. These may be short, elongated, asymmetrical, thin, thick, or visibly protruding. Many women naturally have labia that extend beyond the outer labia, and this is completely normal. During puberty, hormonal changes may cause these tissues to grow or lengthen. The asymmetry often seen, where one side is longer than the other, is also extremely common. Importantly, the size of the labia minora has nothing to do with sexual activity, despite persistent myths. These tissues simply develop differently from woman to woman, forming a unique and healthy anatomy. 3. Labia majora fullness and shape. The labia majora, or outer lips, also contribute to the appearance of size. These structures contain fatty tissue, meaning factors like genetics, weight, hormones, and even aging can influence their shape. Some women naturally have fuller, more cushioned labia majora that give the vulva a larger appearance. Others have thinner or flatter labia majora due to lower fat distribution. Both variations are completely normal. Over time, hormonal shifts, especially pregnancy and menopause, can increase or decrease fullness. The way tissue rests when sitting or standing may also affect visual size. These differences are healthy and simply part of personal anatomy. For clitoral hood variations. The clitoral hood is another structure that may appear larger in some women. This protective fold of skin covers the clitoris and varies greatly in thickness, length, and flexibility. A more pronounced clitoral hood is not a medical issue. It's just another natural variation. Higher estrogen levels during puberty may contribute to increased tissue growth in this area. In some cases, a larger hood provides extra protection for the clitoris, reducing sensitivity or creating gradual stimulation. This variation does not affect sexual function or health. It simply reflects the natural anatomy a woman is born with. 5. Hormonal influences throughout life. Hormones play a major role in shaping the size and appearance of female genital structures. During puberty, rising estrogen causes growth in the labia, clitoral hood, and surrounding tissues. Pregnancy can also increase blood flow and cause temporary swelling, making the vulva appear larger. Hormonal birth control may slightly change tissue fullness, while menopause often leads to reduced estrogen and a smaller, softer appearance. Hormonal changes are not harmful. They reflect the body's natural cycles. Understanding this helps women recognize when size differences are normal responses rather than reasons for concern. 6. The impact of genetics. A woman's genetic background is one of the strongest influences on vulvar size. Family traits, inherited characteristics, and ethnic differences shape everything from skin color to tissue density. Some families naturally have fuller labia, while others may have thinner or more delicate structures. Ethnic factors can also influence pigmentation, elasticity, and overall appearance. These traits develop long before puberty and simply become more noticeable with age. Appreciating genetic diversity helps challenge unrealistic expectations and normalizes the wide range of healthy vulvar appearances across different populations. 7. Tissue elasticity and physical activities. The body's tissues naturally shift in flexibility, and this includes the vulva. Activities such as cycling, dance, running, or horseback riding may temporarily increase blood flow or cause minor swelling. Over time, repeated friction or pressure may slightly change how certain tissues rest or stretch. These changes are harmless and do not indicate injury or damage. Additionally, elasticity varies with hydration, age, and collagen levels. This is another reason why some women appear to have larger features than others. These differences are part of normal biological responses and do not reflect sexual activity, despite common myths. 8. Puberty and developmental changes. Puberty is a period of intense physical development, and the vulva experiences significant growth during this time. As estrogen levels rise, the labia minora, labia majora, and clitoral hood may enlarge, darken, or change texture. These changes are healthy signs of sexual maturity, not abnormalities. It's also common for these tissues to develop at different rates, creating asymmetry or size differences that may remain lifelong. Many girls feel self-conscious during this stage due to limited education about genital diversity. Providing accurate information helps normalize these changes and encourages acceptance during an important formative period. 9. Temporary swelling and irritation. Sometimes, the vulva may temporarily appear larger due to irritation, friction, allergic reactions, or mild inflammation. Wearing tight clothing, using heavily scented products, or shaving may cause short-term swelling. This type of enlargement usually resolves on its own after removing the irritant or allowing the skin to recover. Knowing the difference between temporary swelling and natural size variations helps women avoid unnecessary worry. Applying gentle care, using breathable fabrics, and avoiding harsh products can help maintain comfort and reduce irritation. Most temporary changes are harmless and simply reflect how sensitive the skin in this area can be. 10. When size may indicate a health issue. While most variations are normal, certain symptoms may suggest a medical issue. Sudden swelling, severe pain, redness, unusual discharge, or lumps may indicate infections, cysts, or inflammation. A Bartholin gland cyst, for example, can make one side appear noticeably larger and may require treatment. Allergic reactions to products, yeast infections, or skin conditions can also cause swelling. If changes occur rapidly or are accompanied by discomfort, a healthcare provider should evaluate the symptoms. These cases are usually treatable and not dangerous when addressed promptly. It's important to distinguish natural anatomical differences from signs of potential health concerns. 11. Myths about vulva size. Many myths contribute to confusion and insecurity about vulva size. One harmful belief is that larger or longer labia result from sexual activity. This is completely false. Anatomical size is determined by genetics, hormones, and natural development, not by experience. Another myth claims that only small, uniform labia are normal, which is incorrect. Medical professionals recognize a wide range of healthy appearances. Myths about cleanliness or fertility are also inaccurate. Size does not influence either. Dispelling these misconceptions helps encourage body acceptance and healthier conversations about vulvar anatomy. 12. Comfort considerations in everyday life. Some women with larger vulvar features may experience slight friction during daily activities, especially when wearing tight clothing or participating in sports. Choosing breathable, soft fabrics and well-fitted underwear can help reduce irritation. Using proper hygiene and moisturizing gently can also maintain comfort. During intimacy, larger labia or a more pronounced clitoral hood may affect sensation or positioning, but these differences do not reduce pleasure or sexual function. Communication with a partner and personal exploration help each woman understand what feels best. Comfort is personal, and adjusting clothing or habits can make a helpful difference. 13. Emotional and psychological impact. Many women feel self-conscious about their vulva size due to misinformation, societal pressure, or unrealistic media portrayals. This can lead to shame, embarrassment, or anxiety, even though their anatomy is completely healthy. Education plays a powerful role in reducing these feelings. Learning that the vulva naturally varies helps women embrace their bodies with confidence. Encouraging body positivity, seeking accurate medical information, and avoiding harmful comparisons can greatly improve emotional well-being. Discussing concerns with a healthcare provider, therapist, or supportive partner can also promote self-acceptance. Understanding one's natural anatomy is a key part of overall mental and sexual health. 14. Labiaplasty. Why some consider it. Some women explore labiaplasty, a surgical procedure that reshapes or reduces the labia. Reasons vary widely. Some seek relief from discomfort during sports or tight clothing, while others may feel self-conscious due to societal standards. It's important to understand that labiaplasty is elective and usually not medically necessary. Before deciding, professionals recommend exploring non-surgical options, learning about anatomical diversity, and evaluating personal motivations. The choice should always be based on personal comfort and informed understanding, not pressure or comparison. Knowing the facts empowers women to make confident and healthy decisions about their bodies. Most of the time, a woman's private area appearing larger is simply a natural variation shaped by genetics, hormones, development, and lifestyle. Larger labia or a more pronounced clitoral hood do not indicate health problems or abnormalities. They reflect the incredible diversity of the human body. If sudden changes or discomfort appear, a medical professional can provide guidance. Knowledge allows women to embrace their bodies confidently and without fear. Thanks for watching the Pleasure Academy. If you found this video helpful, don't forget to like, subscribe, and share. Join us again for more factual, respectful, and empowering health content designed to inform and support your well-being.